So, Dr. Reitz, congratulations on being able to present in a Quickshot format at the AAST. Could you give us a brief synopsis of your paper?
Yeah, of course. So we are interested in evaluating the effectiveness of prehospital plasma in the treatment or prevention of hypotension and coagulopathy in severely injured patients. So we used the Pamer study to evaluate patients who received prehospital plasma and the effect of the prehospital plasma's duration of thawed on the both clinical outcomes and then also biomarkers. So there were about 230 patients who received prehospital plasma. We divided them into two groups: those who had plasma that was thawed within 1 to 2 days and then received, or those who were thawed for 3 to 5 days, and then the patients received those, and looked at clinical outcomes, which showed no difference in mortality at 28 days between the two groups. And then we also evaluated biomarkers to evaluate the inflammatory properties as well as procoagulation properties in the two groups. And overall, we found no difference. This is in contrary to the existing literature, which suggests in animal models, the older or had been thawed for a longer period of time plasma might not have the same effect. So we then evaluated a severely injured cohort with an ISS greater than 30 and did find that there were more pro-inflammatory biomarkers in the subgroup of older plasma, which is an interesting correlate with some mouse data, and is the first time anyone's really gotten a chance to look at the clinical use of plasma in this setting.
All right. So very, very nicely done. And could you tell us really, how'd you come up with this idea? What really interested you to pursue this further?
Yeah, so the use of prehospital plasma the use of plasma in the prehospital setting is a really resource-intense therapy. As I mentioned earlier, it has to be used within 3 days of being thawed. So as you can imagine, keeping it stocked is not particularly easy. So we are interested in first if the 5th day of thawed plasma is just as effective as the first day. And understanding that helps us understand the importance of whether or not, it's really worth keeping the plasma in the pre-hospital space, or if we really need to push for something like the frozen freeze-dried plasma, which can be rapidly rehydrated and used, which is currently under investigation elsewhere.
So what do you think from the study results? Where do you think you're going to go next? In other words, what's your next subsequent research study or plan?
I think we are looking for the opportunity to investigate this again on an even larger cohort. So as pre-hospital plasma and plasma hopefully gets used in the clinical setting outside of the rigor of a randomized control trial, we would love to compare biomarkers in patients getting these therapies going forward. And then, as I had already mentioned, Dr. Sperry is actively interested in the freeze-dried plasma as another potential therapy without the same shelf life constrictions.
So if you had to sum up just in a couple sentences, what's the takeaway point? What do you want people to take away from this great research? How would you sum it up?
I guess I would say that the duration of thawed plasma does not appear to have an effect on clinical outcomes for those patients at risk of post-traumatic coagulopathy. However, in a severely injured cohort, the effectiveness of the plasma may be reduced, and that requires just further investigation.
All right. Well, thank you, Dr. Reitz. And then just to follow up the last two questions, is this your first time presenting at AAST?
No, I had the opportunity to present at AAST last year in one of the plenary sessions. We used the Pamer trial in combination with Combat to look at the effect of the prehospital plasma administration in those with blunt versus penetrating trauma. So
Well,
that was the grade.
congratulations on presenting again at AAST and again as a resident. And then why did you submit to AAST? This is now your second time.
Yeah. I had a great time at last year's meeting. It's a good meeting for residents because everyone is very friendly. It's very applicable to surgical residents who, at least at my institution, see quite a lot of trauma and acute care surgery. So it's just a good place to learn and meet people in my field.
All right. Well, congratulations. Well done research study. And it sounds like your career is headed in a very positive direction.
Thank you very much.